Um, Welcome again to the Talking About Kids podcast, the weekly recording that we do with the Arizona Alliance for Adolescent Health. With me, as typical, is Vinny Chilani from Phoenix Children's Hospital, one of the co-organizers of the Arizona Alliance for Adolescent Health. And our guest today to kind of round up this four-part series that we've been doing on eating disorders and body image and nutrition is Noelle Veilleux Markham. And Noelle is a registered dietitian and a population health dietitian at the Arizona Department of Health Services. And really, it was her and her colleague, Brittany Calabrano, that gave us this idea to do this series. And it has been really rewarding. And just to let you know what has happened in the past. So back on November 18th, we released an episode with Bryn Austin, who is the founding director of the Strategic Training Initiative for the Prevention of Eating Disorders, or STRIPED, at Harvard University, when we are talking about prevalence and stigma associated with these issues. On November 25th, we had Jean Doak on, who is the Deputy Director of the National Center of Excellence for Eating Disorders. And she was talking about the harm caused by body image issues and unhealthy eating behaviors and eating disorders. In the episode that was just released this week, on December 2nd, we had Anna Lutz, the co-founder of Sunnyside Up Nutrition. And she talked about kind of how healthy living can really prevent body image issues and unhealthy eating behaviors and eating disorders. So it's been a great series. And Noelle, we always like to start by having the guests give us a little background. What got you interested in this topic?
Sure. Well, thanks for having me. And it's wonderful to kind of wrap up the series after such great speakers. I started, my first job was in childcare. And so I had some early exposures to nutrition, more so through like feeding dynamics and feeding relationships with families. I also had a family member that needed a feeding tube at some point. So I think I was really initially drawn to nutrition as like a career from kind of that feeding aspect. However, I think as some others have mentioned, our culture is very steeped in diet culture. And so I had a lot of that I was bringing personally to kind of moving into this education and field. So I had an awareness of sort of my own challenges with body image and weight and navigating health and food and nutrition that a lot of us bring with us into this field. And so in some ways I had that and was drawn to this side of nutrition that maybe felt a little bit different, thinking about feeding dynamics. And then early on in my career, I was really lucky to have some experiences both in my education and when I first started working from people that really modeled how to move through this space where we do have this intersection of health promotion and wanting to promote healthy living and prevent, bad health outcomes, but also being mindful of the potential harm that exists in some of the ways that we present that messaging or where we focus our efforts and what we put the emphasis on. And so that's really kind of what brought me to where I'm at now.
Your role as a population health dietitian, I have to kind of confess my ignorance, is that a typical role? Will most states, or will there be somebody in that kind of role in other communities, or is Arizona unique?
I can't say for sure. I think we're a little bit unique. My work is also unique in that I've kind of have had the chance to have like large federal nutrition funding, but also smaller federal funding and sort of state funding. And when you have mixed funding streams like that, it just presents the opportunity to be uniquely positioned. And I think that's what we have here in Arizona. So it might go by different names in other states. I think we're starting to see more and more people doing similar type of work, and the crossover in this area, but I don't know that I've met another population health dietitian, I have to confess.
Yeah, that's very interesting. So, Noelle, I want to respond to what you said, and you said something very eloquently, which really resonates with me. So I work with young people. It's that intersection between health promotion while emphasizing body neutrality, body positivity, and health at every size approaches. You can be healthy at any size, and we
Yeah.
recognize at the extremes you might find a clustering of problems. But I work with patients with small bodies and have metabolic concerns of lipid and prediabetes, and people in larger bodies with completely number. And I really preface it with health. And years ago, I had a young lady who was referred to me, and she developed disordered eating behaviors after having been told by her physician, her pediatrician, that you needed to lose weight.
Yeah.
And she had a lot of insight for a 14-year-old. And I asked her to write me something. What's your takeaway from this, and what's your message for young people? And what's your message for physicians and clinicians around how we approach young people about weight? And I have photocopies of what she wrote, and I have shared it with learners, and I will walk into rooms when I have to have conversations about weight, leading with this. And her words are about,
Yeah.
it's never about appearance, it's never about size. There's one you, it's beautiful. And we really have to practice that. At the same time, you might encounter health concerns that need nutritional and lifestyle interventions, but then how but at the same time, not reinforcing diet culture, which can be really damaging on young people.
Yeah, that's really beautiful. And I think the fact that you've carried that with you and that's a bit unique too. We don't always see, I know that doesn't always happen. So I appreciate that you're out there and carry that with you. And it reminds me of some of those early experiences I had where not just your patients, but others that you work with, and just seeing that like, oh, there's another approach that we can take to how we navigate these conversations and these spaces can be really, really impactful. So that's amazing.
Yeah.
One of what Vinny's talking about kept coming up in the series. So, Bryn brought it up, Jean brought it up, Anna brought it up. And it wasn't just the language that we use to talk about bodies. They were also very concerned about the language we use to talk about food, the language that we use to even talk about a disorder. So I think it bears repeating. Noelle, why is this language so important? And what advice do you have for parents and teachers and other direct service providers about how to talk about eating and bodies?
Yeah, it did come through really strongly in each episode. I think the other guests covered it really well in terms of like individually, what can we think about in terms of like our students or our kids, people that we're with one-on-one, really modeling that, being aware of what we say, not even what we say about other people's bodies, but what we say about our own bodies. Yeah. The way that we talk about food, making judgments about what other people are eating or, what we're eating, and really removing judgment from those casual conversations and comments that we make. And I think the other guests covered that really well. In my role, something that we have to consider too with our language is our broad, like public health messaging. And so that comes up in our work through things like, public health awareness campaigns, things that you might see on a billboard or on the radio, flyers that you might see for like a health promotion class in a community. And one resource that we have relied on and developed a few years back is called The Language of Health. And it's publicly available. It's available on our website, but it goes topic through 6 topics, health, body size, nutrition, physical activities. And there's common threads and there's nuances in each of these different sections of things that we can be aware of. And it really, this resource really frames it as what are messaging strategies that are effective. And so that might be something like health is weight neutral, all bodies are good bodies, all food fits. And then there are messaging strategies that are ineffective. And we see that mirroring some of the things that other guests talked about, like really avoiding stigmatizing messaging, things that speak negatively about bodies, things that speak negatively about foods, categorizing foods as good or bad, when we know that the food that people eat is influenced by a lot of things besides individual choice. And so that's one resource that we have really relied on a lot. And it's important not just because of the effectiveness, right? There's that rationale value and like, is this message going to be effective or is it going to be ineffective? But I think coupled with what the other guests have shared throughout this week, there's the harm and the potential damage that comes along with sharing messages that you might think that it's going to be effective. It's not effective, but also it's really harmful. And it can be tricky to know those nuances. And so it's been a really helpful resource that we've utilized over the last 5 years internally with our own messaging. And then also trying to get the word out and share it with others, so that they can use it too, because words stick with us. I think Vinny shared that patient where, one doctor said something that I'm sure was well-intentioned and I'm sure there was rationale, but these words just have other meanings or ways that we hold within us that really do have long-term, impacts.
Yeah, in fact, for those of you who haven't heard it yet, when I asked Anna Lutz if she could have a magic wand and change one thing and improve outcomes around eating and eating disorders and body image for all kids, what would she change? And she said that she would make weight, she would eliminate weight as a marker of health. Right. And that was really, I think very powerful. And it speaks to what you said, Noelle, and also to what you said, Vinny. I mean, Vinny, we do worry, though. We just had a big announcement in the news about the rate of obesity in the United States. And universally, people seem to believe, obesity is bad, that it does shorten lifespan, that this is something that we need to be concerned about. Maybe for both of you, but Vinny, you've dealt with this too, is like, where's the balance? How do we strike a balance between the language that we use and making sure that people are the healthiest that they can be?
Yeah. But Brad, my sense is you find that balance with that individual person. It's very individual balance. It's about your own triggers, your own predispositions, your own experiences. In my work, for example, I have patients with disordered eating behaviors or history of disorders, and I ask them, like, at the same time, like, is it like, make sure that you turn around and don't look at your weight if you don't like the stimulus. And in our working together, sometimes there's a part of me that wants to know that I'm doing a good job and that I speak of the concerns that we need to keep an eye out for. But at the same time, I care about how my words may and may not make you feel. Is this a discussable or is this not a discussable? And they will give me permission to discuss it. And I have patients where we decide that it's not a discussable, not unless it's a grave risk, is sort of, and I put that at the chart level so I know how to lead my conversations. But you see, this is very similar to the world of sexual and reproductive health, where I've also lived. There are sex positive approaches, and we can be as sex positive as we want, but unintended pregnancies happen and sexually transmitted infections happen. We have to find that balance where we are also mindful of the risks that can potentially come with what may sometimes be difficult to discuss.
So, Noelle, I don't think that you're going to argue that an individualized approach is best, but you're dealing with the state of Arizona,
Population health. True.
and
Very
we've
different.
got people in, listening right now who are maybe dealing with a classroom of 30, hopefully no more than that, but 30 plus kids, or they see a lot more than that over the course of the day, or many more than that in their program. You've already given us some ideas of things that we can do universally that work, right? Look at the language that we use to describe foods. Look at we as people who are working with kids. Look at the way that we talk about our own bodies and the bodies of people around us. And we picked up from some of the previous guests how we talk about dieting and how we talk about our own struggles, and the words we use can be like really impactful. So after we take care of our own backyards, as it were, as people that care about and work with kids, are there some other strategies that can work in a broad way? And do you have resources? You mentioned that language sheet that's available. What other resources and what other strategies can we apply beyond the individual ones?
Yeah. Well, first I want to just go back really briefly and just thinking about, where do we place the concern about weight? And I think, for that teacher who maybe, has a class of students and maybe they, are feeling concerned one way or the other. One thing that I really think we have an opportunity to do is shift, is our weight and health really tied together so closely, or is there something else? Are we making assumptions based on someone's weight about their physical activity levels, about their eating behaviors? And there's really an opportunity to shift from focusing on weight as the outcome to behaviors, health promoting behaviors. And that allows us to move into a space where we're still thinking about health. We're still but we're getting more to the root issue, right?
Mm.
And it leaves space for, all the things that impact our weight that are not just what we eat and how active we are. Because when we boil it down to those two things, it can be really tricky. It just gets a lot trickier. But to your point, there are some resources that are available, for not just teachers, but I know there are lots of folks that do youth programming in their communities. Two that I can think of to share is one that was recently developed by our team is a curriculum tool, a curriculum assessment tool. And this, we use health curriculum sometimes in the school day, but sometimes after school, sometimes at a library, sometimes at a community center. And health curriculum can be a tricky thing to look at, right? And so we developed a tool to help discern, is this something that is going to be valuable to students or kids that I care about, that really is addressing health in a way that's going to be positive and health promoting? Or are there potentially some things that we have to be concerned about? Is there an overemphasis on calories? Is it talking about, moving your body as a way to compensate for food that you eat? Because sometimes we see those things in curriculum that people are teaching or that kids have access to. So that's one thing that I can share that's been recently developed just to help people navigate and understand, how do I make sense of this if I have this choice to make? Something else that's available for schools is a curriculum that's free to teachers. It's called the, I don't want to get the name wrong. It's the Body Confident, Body Kind curriculum for schools. And it has a little bit of a different focus on body image, which is still very important and relevant to health, but is maybe a little bit different than maybe a typical nutrition curriculum. And so these are some of the new emerging, dare I say, what feels like cutting edge resources that we have available, that for those teachers, for those coaches, for those adults that say, I have all these kids that I'm interacting with, I care about their health, I want what's best for them, but what's available to me? And so those are two things that I would really, recommend as something that could be helpful in kind of navigating those spaces and making those decisions.
One of the things that I wanted to ask you about too is like, when you are addressing something on as big a scale as you're doing in a whole state, a whole community, or even a
Yeah.
whole classroom, how do you know if something's working? And do you have things that you know are working right now in what you're doing in the state of Arizona?
Oh gosh, that's a big question. So I mean, I think in public health at the population level, when typically that's like long-term outcomes.
Yeah.
So you know something's working when you see those changes in the data, usually a long time out. But I can share, I think maybe more anecdotally some of the feedback that we've been getting or that we've gotten over the last few years and kind of trying a different approach. And um, is that many times people, practitioners, maybe health educators in a community, share like almost a sense of relief
Mm.
of having another way to talk about food or health or nutrition in a way that they feel is maybe a little bit more respectful or um, I don't know, honoring or relevant to the people in their community that they're working with. So that's been good feedback to hear, to know that there was openness, right?
Mm.
Because this does sometimes maybe feel like, oh, this is a little bit new. I'm not sure if this is going to be so different or if there will be great opposition, but there's been quite a bit of openness from practitioners and others that feel motivated
Mm.
by having some resources to try maybe a different approach in their work. Um, and then programmatically, I think we have some programs in our bureau that have gotten some really great qualitative feedback in not just, the shifts in our language, but other changes that have been happening, trying to be more community driven, trying to take approaches that are more trauma informed in their work. And they've gotten some really rich qualitative feedback from participants about feeling, listened to or resonating with that, in this case, maybe a curriculum. But at the end of the day, in a community, right, we're talking about people that are taking time to come to a space and finding out that maybe they're feeling a richer connection with, a health provider, a community provider, than they had felt differently. So I don't know if that totally answers your questions. I think, long term, we'll yet to see what the data shares, but in those interpersonal, anecdotal, kind of qualitative perspectives, we've gotten, I think, positive feedback that this feels good to people and has the benefit of still promoting health in the ways that we want to see too.
One thing, a theme that I heard from the guests prior to today, also had to do with fear of food. They wanted to have kids raised so they're not afraid of food. And I
Mm-hmm.
think that was really interesting because I think my experience, at least, is that, look, if it's your day to bring snacks to the soccer game, it can be charged. It can be like so very, very stressful. Or if you're in a classroom that actually allows for celebrations of birthdays or something like that, what you can do and what you can bring, if you're a parent or you're a teacher or a teacher's aide, you're running the after school program, it can be very, very stressful. And that's independent of any fear that I might have that's associated with my body shape and my body size and what I want from me. Let's talk a little bit about this fear of food and how it manifests and why it can be so dangerous.
Yeah, I mean, fear of foods, eating disorders and disordered eating, are complex. And so I don't want to like whittle it down or oversimplify
Mm.
anything. But one thing that comes to mind to me as it relates to food and nutrition and the messages that we're sending out is sometimes we do oversimplify food of like, these are good foods, these are healthy foods, and these are bad foods, these are unhealthy foods. And that can, cause some of that fear. I can't remember if it was Anna or one of the other guests, but, thinking about little kids and what concrete thinkers they are, that, if they've heard a food is a bad food, and then, that's something that's offered to them, or maybe something that they really enjoy, because a lot of times these bad foods also taste really good, there can be that fear of, well, does that mean I'm bad? Or,
Yeah.
my school is bad, or my grandma is bad, and wrestling with that. And then we
Or my
also have,
classmate who is eating it,
yeah,
right, is bad
right.
because they are, right? Or their parents are
Yes.
bad because they gave it to them. And
Yes.
right. Yeah.
Yeah.
I think one of the things that I found refreshing, and I think that we all have our corner of the kid world, and we have our issues that we're really passionate about. And sometimes, I have met advocates that are passionate with to the expense of everything else. Their issue is the one that we have to focus on, and that's the most important thing. But the people that took the time to talk to us about this issue, several of them pointed out, if foods are preventing you from connecting with other people, that's bad. The connection we still have at the center of so many of our rituals, meals. We still have, foods that are used to like bring people together in parties, in events and holidays. Like we just celebrated, are in the season of celebrating. There are so many important holidays that happen in December and January that revolve around dishes. And what I heard, at least from some of the guests, was that community might be more important than the nutritional value of the food that's being served. And that you don't want any sort of prejudice about the food to get in the way of connecting with other people and that community. Do you have any thoughts about that, Noelle?
Oh, yeah. I mean, I would agree with that for sure. I think it's really important and really valuable to acknowledge the role that food has in our society, and who we are as people, as families, as a community, culturally. And I 100% agree with that sentiment, that that piece of it is vitally important when you're thinking about, is this good or bad? Is this healthy or unhealthy? It's so much more than just the nutrition content. It's so much more than just the nutrients in the food. It is that whole picture. And yeah, I would agree with that, kind of idea of, if there's so much fear and anxiety around, being able to, have birthday cake with friends and family, that it's preventing you from connecting, or going to that gathering, or it's just occupying so much of your mental space. That is a consideration. It's not just, oh, well, I don't, eat cake, or that's an unhealthy food. There's definitely space to think about health from a more, holistic viewpoint of like, how is this affecting the whole person?
So I just want to speak to that cultural lens and how critical that is. Like some part of this is really a very distinct Anglo-Western perspective. And in my work with like Native American communities, like there's such a return to, like, to thinking of food as medicine, and your body needs medicine. And while recognizing what foods were not sort of native to inherent to, and were like, there's a little bit of recognizing of the impact of colonization, but there's also the sense of food as fuel and food as medicine.
I think that's excellent. And Dr. Chulani, since you started us off kind of with that, the wonderful advice from the patient that had such an impact on you, I want to give you the final word here. What other advice do you think that patient of yours would have for the listeners?
I might have to just restate it, right? Like there's many ways to be in the world, and there's many ways to walk in the world, and we come in there in different shapes and sizes, and the one thing I also speak to my young people about is, if you think that it's never about the body. It's often in the context of maladaptive coping, and how we see ourselves until we discover our ego strengths, that we're vulnerable to it. And if the aim is to achieve a perfect embodiment in a perfect body, you might attain it, but time will take it away from you anyway.
Well, I just want to thank everybody. Noelle, I thank you so much for being a guest today. Thank you so much for the resources you shared, and also just thank you for inspiring this series. This series that Talking About Kids does with the Arizona Alliance for Adolescent Health, that's going to be on a break for January, but we'll be back in February. So be on the lookout for the announcement of that. And everybody have a safe, healthy, happy, and communal holiday season. Thank you so much.